So there's a clear distinction between the wild polio viruses that we have eradicated in Nigeria and indeed the whole of the African continent. This is distinct from the current outbreaks of a different type of polio virus. So this is not a wild polio virus. So this is a virus that exists where there is low routine immunization. That is to say, where women are not taking their kids for routine immunization services. So they are not taking their kids to go and take their shots against polio, against measles, against yellow fever. You know, like our parents used to do. You know, where our parents would take took us to the health facilities to make sure that we have the full range of routine immunization vaccines. Now, where there is low routine immunization and where there is poor water and environmental sanitation, then you begin to see that the vaccine-derived virus mutates, just like you see with Covid-19 mutating, right? You can see that happening with the polio virus as well. And this is why we've had these outbreaks in different parts of the country. And we have, right around about 121, cases, whether they are in the environment or otherwise. But working with the Northern Traditional Leaders Committee on Primary Healthcare Delivery, we've been able to mount outbreak responses to make sure that the tools that we're using will ensure that these outbreaks stop. So we're in control of the situation. We're hopeful that before the end of the rainy season, we'll be able to carry out enough campaigns to make sure that we're able to cover this. The one other thing that is going to help us ensure that we don't see these types of outbreaks again is the increase in routine immunization coverage. So since 2016, when we had the routine immunization coverage of about 33%, we have now increased it up until 71%. So we have more than doubled routine immunization coverage. But we need to get to around 90% before you stop seeing these types of outbreaks of diseases. We're not there yet, but the unprecedented increase in routine immunization coverage is going to help us, right? One thing that is clear is that globally there's never been such an increase in routine immunization coverage, like we're seeing in Nigeria. So we continue to work with traditional leaders. They've been very instrumental in making sure that they convince mothers, fathers to take their children for routine immunization. The meeting here today is really to see how we can focus on the different diseases and the root causes, right? We cannot chase every disease, right? Cholera, then chase CVDPVs or chase diarrhea diseases. We have to look at what is the bottom line. What is causing this outbreak? It is because people don't have good water supply. People are not observing environmental sanitation, and the traditional leaders are working towards how they can increase the knowledge of their subjects so that they understand the link between poor water sanitation, poor water availability, and poor environmental sanitation, so that they can clean up their environments. These kinds of conversations are happening on a quarterly basis, and we're hopeful that it can bring about behavioral change.
About the vaccines in Nigeria. And I want to believe Nigerians are really going out themselves to request for it. In my state, and from all the responses I had from my colleagues, there is every hope that the vaccine stock we have at the moment will be exhausted, will be taken by this country. But what we intend to do as a committee is, one, to lead by example. I have taken my 2 shots from the onset, and I believe every member of the committee has taken. And we've also advised and guided our councillors and members of emirate councils to also take. Most district heads and village heads have taken. These are leaders of our community, and the people have trust in them. And being the first to take, we will ginger other followers to also accept to take. Apart from this, we've also been talking to people about what we believe to be the position of the vaccines, that they are safe. COVID-19 is safe, is in this country, it is dangerous, it kills, and the only cure, the only preventive measure available to everyone at the moment is the vaccine. So we're leading by example. We are also talking directly to the people. We are bringing in traditional and other traditional leaders on board. We are bringing in all religious leaders that can influence people to also speak on the subject.